Today, the Kidney Association of Belize partnered with other organizations and health associations to conduct its annual health fair.
The purpose for our health fair is for us to basically know that the kidney tests that each individual are going to be taking, is if it's at borderline or if it's above, we will have intervention in having them visit a doctor, giving them advice as to what to do pertaining to their kidney functions.
With a growing population of diabetic and hypertensive patients, the need for kidney tests and screening is higher than ever. Today, the Kidney Association of Belize hopes to reach 400 people. But are Belizeans generally interested to know about the health of their kidneys?
Yes, it may not be to the extent that we would want, but there are awareness happening. Kidney disease is on the rise. Why? Because the two main causes of kidney disease is hypertension and diabetes. So if hypertension and diabetes is on the rise, automatically kidney disease will be on the rise.
What are some of the most common kidney disease that we're seeing in Belize, or some of the complications that are more common?
The most common that we're seeing is end-stage renal failure, where the patient arrives at the doctor and the doctor says your kidneys are no longer functioning, therefore you need dialysis. That's the most common. There are other kidney disease like kidney stones and other disease, polycystic kidney. The doctors would be the ones to give us more information pertaining to those. But we are recognizing that once you are a diabetic and hypertensive and your numbers are continuously high, then you are a potential candidate for kidney disease.
What are some of the challenges that you face in terms of encouraging people and getting them to come out to check the status of their kidney?
It's kind of so sad that health should be the number one priority for an individual. So therefore, when we have entities, because it's not only Kidney Association of Belize, we have HECOPAV that goes all over the country that tries to bring people to come to a health fair. It is so sad when we would disseminate such information that we have limited participants coming in. And I can't begin to understand why, but I want to send out the alarm that if we don't take care of our health, if we don't let that become a priority, then we will end up having difficulties along the way.
And if you're wondering whether you need to get a full body checkup, perhaps you should, and be sure to include your kidney. Nicholas says that at times there may be symptoms that something is wrong, or there may be none at all until it's too late.
Sometimes it doesn't give you a sign. If you're getting signs that your kidneys are bothering you, it's because it's at the end-stage renal failure. So this is what the doctor would advise us to do. One, if you're a diabetic or hypertensive, visit your doctor frequently. Run all your necessary tests. Kidney disease is what we are focusing on because we are Kidney Association of Belize. But the doctor will also tell you that it also affects other organs like your eyes, your heart. So we would ask you to come in regularly. If you're not diabetic or hypertensive, do an annual checkup. Let the kidney function be a part of your annual checkup. Now there are symptoms. For example, you may have swelling in your feet, you may be dehydrated, frequent urination, pain in your back. But what's happening is that these are symptoms that can be associated with other disease.
Reporting for News 5,